As was mentioned, I'm Sam Pettyjohn from Health Literacy Missouri. This is Megan O'Connell, and today we're going to be talking about what is health insurance literacy. We talk a lot about what is health literacy. Obviously, our organization is Health Literacy Missouri, and health insurance literacy is kind of a separate term in a sense, but it shares kind of some of the core concepts behind health literacy. So we're going to speak about that. We're going to talk about some barriers that we know Missourians will probably face when it comes to trying to understand the healthcare exchange, as well as being able to register, get enrolled, and do all these things. And then finally, we're going to talk with you about some strategies to be a better communicator, both with written and spoken material. And that'll kind of be how we kind of wrap it up. I like to start with a definition when we talk about health literacy. Unfortunately, I'm going to share with you this definition. So this is from the Affordable Care Act, and it says, the degree to which an individual has the capacity to obtain, process, communicate, understand health information and services in order to make appropriate health decisions. Does somebody want to translate to me what this means exactly? So I think there's a certain amount of irony when we talk about health literacy, and then this is what we use for our definition. The biggest problem I have with this is the fact that this puts all the onus on the clients that we're here to serve, right? It's the client's responsibility. They need to have the capacity to obtain and communicate and process and understand all this health information. That really kind of leaves us as healthcare professionals out of the equation to a certain extent. So what I want to talk about when I talk about health insurance literacy today is empowering our patients, empowering our clients to be able to make good healthcare decisions. I think of it more in terms like this. On any given day, we have our clients have the ability to make the best possible health decision for themselves at that time. And think about what an important health decision choosing the proper plan and choosing health insurance coverage can be. Think about that one health decision they're going to make that day. Think about the impact that can have on their entire lives. So we're really here to help empower our clients to make the best possible healthcare decision and make the best possible choice for their healthcare coverage and enrollment.
Okay. So Sam talked a little bit about what health literacy and health insurance literacy is. I'm going to talk about plain language because for Cover Missouri's purposes, health literacy, practically speaking, is about plain language. And contrary to what you might think, plain language does not mean speaking and writing so that everyone can understand. It means speaking and writing so that your intended audience can understand. It's really critical to know your audience and understand your audience so that you know what message they need to hear and you know how they need to hear it or read it, as the case may be. And it's been shown that the more a message matches an audience, the more likely that audience is to act. And we all know there's one very specific action we want people to take, to buy and purchase a new health insurance plan. So really important to understand your audience. Let's talk about some barriers that Missourians are going to face. First barrier is reading level. I'll give you a moment or two to look over these statistics. So this is particularly striking because most health education materials are written at a 10th grade level or above. And yes, and much above. So 11th, 12th, 13th grade level, I see it all the time.
What is newspaper level?
So that's an interesting question. In journalism school, newspaper journalists are taught to write at a 6th grade level or below, but it's not evaluated, so that's not always the case. So yeah, health insurance materials are often written at this really high grade level, so that means they're not accessible to a huge chunk of the population. So Cover Missouri has done a really great job of getting the reading level of their documents and their toolkit way, way down. So these are great tools that you can use to communicate at a lower reading level to make sure that people can understand. But I'm going to give you some strategies to work with a document that's at a higher reading level because you're very likely to run into those, especially with insurance documentation. So we'll talk about that in a little bit. Let's talk some more about barriers. On the left, you'll see a form that all applicants have to fill out in order to obtain MoHealthNet services. Some of you may have seen this in your work, but so once someone learns about the program, figures out that they might qualify. Again, this is for parents, kids, and pregnant women. This is the first hurdle that they have to clear before they obtain services. So it's pretty intimidating. This is a health insurance claim form on the right from CMS. So not quite so cluttered as MoHealthNet, but a still pretty comprehensive form. Might be pretty intimidating for someone with low literacy. This is a screenshot of healthcare.gov. which is where people are eventually going to go to compare prices and buy plans. There's a lot of really great things going on in this website. There is a live chat feature, there's a countdown, days left till enrollment, there's a why are we asking these questions, really important principle in adult education, tell them why. A lot of white space, great font, but I see a few words that are pretty problematic. So we have eligible, we have coverage, we have employer. So these are insurance terms that we kind of can't get around using when we talk about this stuff. But at the same time, low literacy readers might have trouble understanding it. And so we'll get to those strategies right now. Okay, first strategy is to use analogies. One really effective analogy that Cover Missouri uses is to compare the marketplace to a travel website, like some of the ones you see here. So a place that you can go and compare prices and buy hotel rooms, airline tickets. So right away, that analogy makes the marketplace, this idea, instant visual, really accessible to a huge number of people. However, it's important to remember that there are a lot of people that this analogy won't work for. The people who don't use the internet, maybe you're elderly, the people who don't travel. So that analogy could actually make it more difficult for people like that to understand. So we have to keep in mind that analogies have to match your audience. So what's everyday, relatable, accessible ideas to your audience? Are there any analogies that you can come up with using those ideas? So this is one example, but I encourage you to come up with your own. Okay, fun exercise time. I'm really excited. This is my favorite. This is going to get your juices flowing after lunch. We're going to play a game that really kills it at the health literacy conventions, and I'm going to need your participation. So what I'm going to do is I'm going to highlight a phrase on the screen, and if you all can just shout out what you think that phrase means. So what do you guys think cubic containment system means? Stan, you have seen this before. Was that you? Don't cheat, Stan. Stan, you're disqualified. Okay, a box. Yes, it is indeed a box.
That's right, exactly.
That's true. Stan forgot. Okay. Misapplication elimination device. Anyone have any ideas?
It's an eraser. I see it on your website.
Oh, we have a regular. It is indeed an eraser. What about a follicle redistribution mechanism? Any guesses? That is a comb. I know, it's hard. Vermin de-infestation apparatus. Mousetrap? Anything else? Fly swatter. It is a fly swatter, but we've been hearing a lot of mousetraps. I think we're going to have to amend the presentation. I've heard that enough that I think it's pretty clear. Mm-hmm. We did our audience testing. So.
That's right.
Okay, horizontal tranquility terminal. A bed, absolutely. Okay, well, thank you guys. You've been great. We're done here.
No,
see you later. No, I'm just kidding. But so this exercise is really fun, but we think it also shows how really simple ideas can become really complicated and really hard to understand depending on what words we use. So if we use the wrong words, something that might be easy to understand is no longer easy to understand. Okay, let's talk about numbers for a little bit. This chart comes from the Frequently Asked Questions for Individuals and Families document in the Cover Missouri Toolkit, and we think it shows a really effective way to present a large quantity of numbers, which is something that people with low literacy can often find very confusing. So there are so many dates involved in the marketplace, and it can all get really jumbled, really confusing, even for someone with high literacy. And this chart is a great way of laying them out clearly and in a friendly, kind of visual manner. Sam, you want to talk a little bit more about
Sure.
visuals?
So we also know that, again, charts are a great way to display numbers for people that maybe have low literacy. So what they've done here that's really effective is they've used this striping in a sense. You'll notice that this is green, white, green, white. What this striping does is it allows the eye to naturally track across the page. So if you're going to talk about specific dates and things like that, it's very easy to say, okay, so if you enrolled, say, in this time here, or when you purchased, this is when your coverage starts. It's very easy to follow across. So if you find yourself needing to make materials in this process when you're doing enrollment and doing these things, if you find yourself using charts, this is a really effective way to make the information fairly easy to read. Also point out the columns. See how they're big? There's a lot of space between the columns. It's really easy to tell kind of the information in this area and then in this area, how separate those are. So that's just a really kind of quick way you can make a lot of numbers a little bit easier to understand if you want to use a technique like this.
Yeah, so one last note about the chart. It's a really great tool. I would encourage you also to interact with your clients using this tool. So, if someone's standing there looking at this document, you're right next to them. Oh, so what date did you buy your coverage? I bought it on December 20th. Okay, so that's great. You bought it on December 20th. That means, and then you circle it. Your coverage starts on February 1st, 2014. So it's a starting point. It's a really good tool to get you started, but it doesn't replace interaction, because readers should never have to infer how a number applies to them. It's up to us to explain it. Okay, let's talk about that reading level. You'll remember that we're dealing with stuff at the 10th grade level or above often. So some of these strategies can also apply to spoken communication, so I'd encourage you to think about that as well. One huge problem, big contributor to reading level, is long sentences. So when we're dealing with a material that's high reading level, long sentences, can we break up those sentences into 2 or more? The polysyllabic words, the jargon, this is probably the #1 problem we run into with health insurance, is that those terms are long and we can't avoid using them, and they've always been confusing and they're always going to be confusing. But can we substitute simpler words? And if we can't, can we explain a complex term right after we have to use it? So if you have to say your employer will pay this, could you say your employer or your job? Explain it in a simple way after you have to use it. Or can we just limit our use of the word? If there's not enough text, can we add more? And if there's too much text, can we delete what's unnecessary and focus on only what the client needs to know? So like I said, the Cover Missouri docs get this reading level way down, but be prepared to use these strategies when you do come across documents that are at a very high reading level.
Great.
Yep.
I want to talk to you for a second about being patient-centered client-centered when we kind of engage with our patient population, our client populations that we'll be actively recruiting. When I think about being client-centered, I tend to think of it in terms like this. So today, when you leave here, you're going to be an utmost expert in everything that has to do with Cover Missouri, right?
I don't think so.
Oh, well, let's assume that you're going to be an utmost expert in all these things. The first person you interact with is not going to be an expert in all these things. So think about when you were just learning about this, when this was a new idea, what were the questions that you had? What were the concerns you had? Where were your anxieties placed when it came to working to understand these things? And assume the people you're going to be interacting with are probably in that place now. And so you really have to work to put yourself in the mind of the clients you're interacting with and try to figure out what you think the stumbling blocks might be. And we know, obviously, the more often we do this, the more often that we're going to work with these clients, we're going to get a better sense at how to answer some of these questions. So just kind of keep track of some of the places where you see people stumbling, where you see the questions kind of popping up again and again, and really work to craft your answers to kind of meet the needs of the clients you're serving. Try to slow down whenever you speak. We know there's this actual thing called a friendly conversational tone. It's between 110 and 150 words per minute. I'm going to get everybody a stopwatch, and from now on you're going to walk around in time and see how long it takes you to deliver your talk for Cover Missouri. Actually, that's obviously not something we're going to do, but just know that if you've said the same thing over and over again, if you find yourself building a script around the things you're telling the clients you're working with, that's going to become almost memorized. And the faster, we tend to speak faster when things are memorized. Our brain is actually wired in a sense that we don't have to recall information. If we recall information enough, it becomes, in a sense, memorized and tends to come out of our mouths very quickly. So if you think you're speaking at a normal pace, just try to slow down a little bit, especially when you're explaining this very technical information to your clients. Work to prioritize the information. What is the most important piece of information that the client needs after this encounter is over? We tend to think of this as what is the most actionable piece of information? What can we do for them and say, okay, we've gone over this, now you need to make sure you turn in this paperwork, you need to call this phone number, go to this website, send your check here, do these things. Give them very concrete action steps that people need to take after they've had that interaction with you. And then finally, find a way to check for understanding. We recommend encouraging people to ask at least one question, or ask one question of the people you're working with. And I want to tell you the difference between a closed question and an open question. Does everybody know what a closed question is? That's actually a closed question I just used there. But yeah, so we want to steer clear of these yes and no answers. Do you have any questions? Do you understand? Maybe you could say something along the lines of, I know your family is going to have a lot of questions about how you're going to get enrolled in the insurance when you go home. How are you going to tell them? What are you going to do? How are you going to help? How are they going to help you kind of make sure all these things happen? Or what do you think is going to be the easiest thing for you to do for all these steps you need to meet? And you can talk about that. Or what do you think is going to be the hardest thing for you to do? Or I know that talking about insurance and healthcare, it can be kind of intimidating. you're going to have a lot of concerns. What are the things that are bothering you about this process? What are the things that you're least sure of? What can I help you with? And these are great ways to kind of keep that conversation going and make sure that the people we're working with, in a sense, comprehend all these messages we're trying to convey to them. We also know that there are these red flags we see in nonverbal cues. And they might be kind of a dismissive body language. They might seem to be anxious or just generally embarrassed about having to talk about this subject. You might see incomplete forms coming back to you. That's a big red flag for people not understanding questions or having questions and not asking. That's a great way to engage them around those answers that aren't there. You might find that they don't want to ask any questions or interact other than just kind of look at the page that you might have given them. And they might generally avoid the topic altogether. If they know you're going to be somewhere, they might be avoiding you in general. So just try to do your best. When you see these things, it might be a big cue to maybe engage in some of, really focus on some good communication strategies to make sure your message is getting across and really make sure the clients you're working with are comprehending the message. I like to finish and say, you can't tell by looking and you can't expect people to tell you. So if you said from now on, whenever you're going to work with a client, you can say, do you have difficulty reading? Do you think that that's an answer you're going to get an affirmative answer to? Do you think people are going to say, yes, I have difficulty reading this form, or I need extra instruction? The best thing we can do is assume that all the clients we're going to be interacting with will benefit from this clear, concise information and will benefit from using some of these instruction techniques that we've talked about. So we know if we can do all these things, we really want to help educate our consumers in Missouri so they're making the best possible healthcare decision like we talked about earlier. And we know people that are enrolled in insurance are typically just a little bit healthier than people that aren't. So we can work on working on prevention, working on primary care, making keeping our chronic conditions from becoming acute, doing all these things and really working to empower our patients, empower the people of Missouri to kind of become an active participant, an active consumer of their healthcare. And I think that's kind of why we're all here today. So just think a lot of this can start with just some really good basic communication skills and think about the impact that you can have on the people you're going to be working with. All right, thank you very much. We're having a summit in St. Louis, October 4th. If you're interested in learning more about health literacy, you can go to our website, healthliteracymissouri.org. Megan has her card here, but that's her email. We'd love to talk to any of you more about any of these opportunities where health literacy might play a role. Thank you very much.